I've been a proud physical therapist for greater than 20 years and a member of the UPMC leadership team for the past 11. I'm joined at the podium by Dr. Melissa Michaluk, a physiatrist and the medical director for the Rehab Institute here in Williamsport. For greater than 50 years, UPMC Williamsport has proudly served patients in need of inpatient rehabilitation, creating a legacy of the highest degree of clinical excellence. In addition to 3 disease-specific certifications from the Joint Commission for brain injury, spinal cord injury, and stroke rehabilitation, our team has a robust number of nurses with their certification in rehabilitation, multiple therapists with advanced training and certifications, highly competent and kind physicians and psychology staff, and an exemplary track record for both patient outcomes and patient experience. The team's dedication and engagement are remarkable. In stark contrast, however, our aging facility was not in alignment with the clinical acumen of our care team, and after several years of planning and subsequent construction, we are now sitting in a state-of-the-art space that will support continued clinical care of those we proudly serve for decades to come. The $22 million investment to modernize existing space has created 30 private rooms with ensuite bathrooms, 2 state-of-the-art gyms, a patient apartment, a quiet sensory treatment space, multiple private treatment areas supporting speech therapy and psychology services, and an abundance of additional support space for group treatment, support groups, celebrations, and staff education. This space is not only aesthetically pleasing, but has allowed for additional services including telemetry, elopement prevention technology, electronic therapy schedules, on-unit dialysis capabilities, music therapy, as well as a low-level head injury program, which will be one of only 3 programs of its type in the state of Pennsylvania. We are deeply grateful to UPMC leadership for their support of our program. Similarly, we are incredibly grateful to the Susquehanna Health Foundation and their generous donors who supported this project. I would also like to thank our UPMC facilities team, BDA Architecture, and Ausley Construction and their subcontractors for their incredible partnership and sharing their gifts with our team to create this beautiful and functional space.
Every time I walk onto this unit, every time I interact with this team, talk with the providers, I'm at a lack of words. I'm awestruck by the passion and the care that you provide every day. To me, what we're seeing here today is our daily focus on putting the patient at the center of everything we do and making sure we provide them with exceptional care. I came to this community about 8 years ago, a little over 8 years ago, and this was one of the first things that sort of came across my desk as a project to work on. And at that point, it was to tell the compelling case and story for why we needed to renovate and create this new unit. And much like Tim said, we knew we were providing exceptional care, some of the best, not just in the region, I would argue, in the world. But we knew we had a facility that didn't match that level of care. So we worked on telling that story. We worked with the foundation, with many of the community members, the elected officials, donors to secure the funding. And then the vision started to get painted. And you're standing in the campus right now. You're seeing that vision come to reality. And it's just so impressive to see it come to life. I guess it was about a year ago when we opened the first phase of the program. I was equally impressed just with the first floor. And I couldn't believe that we could do more and go further with the completion of the renovation. And in that time period that transpired, I had the opportunity to participate in a spinal cord injury support group. I had the opportunity to come up and witness a staff meeting. I had the opportunity to interact with some community members who needed this life-changing care that you provide here and could not believe they had that access so very close to home. So I'm truly humbled and honored to have my name even closely attached with the work that we're doing here. And I'm humbled and honored by all of you, all of those that stood when Dr. Michaluk read all of those different things we do each day. I'm tremendously proud to be part of this community, tremendously proud to see this project come to completion. And I thank each and every one of you that had any part in making that happen. And I'm very happy to be here today to celebrate this occasion. Thank you very much.
you're gonna cut?
Yes.
After
So
one.
3.
Okay, wait, no, I'm not ready.
Okay. I got the ready, set, go. Okay, 3,
Yeah.
2, 1.